This is the final plenary session on opportunities and barriers for India to lead the way towards integrative care. This session will be moderated by Mr. Rajiv Vasudevan, Chairman CII Ayush Forum, Founder and CEO at Ayurved Hospitals. May I please request our guests to join us onto the dais. We have Shri Vaidya Rajesh Kotecha ji, Secretary Ayush, joining us. Dr. Atul Kochar, Chief Executive Officer, NABH. Mr. Pankaj Sahani, Chief Executive Officer, Medanta, the Medicity. And Dr. Shankar Narang, Chief Operating Officer at Paras Hospitals.
Good evening, good afternoon, and it's wonderful to be here today at the fag end of a very interesting day. I was fortunate to listen to some of the earlier sessions, and we had a wealth of knowledge and insights which was shared by very illustrious speakers from the earlier sessions. As we get into this penultimate session for the day, in the time available, and we have a galaxy of excellent speakers here, in the time available, what we're trying to look at, as you heard from the topic, was how can India lead the way in integrative medicine? It was not about what to do with integrative medicine. How does India lead the way for the world? This is one key point which comes. We have to understand 2017, right? Time for a new health policy, but the national health policy in 2017 enunciated a pluralistic, fantastic vision for a country like India. I think it laid out a roadmap which every Indian should be proud about, because I think it articulated everything that is part of a very healthy perspective on what the common man deserves in terms of health, right? Translating that into reality, backing it with budgets, backing it with implementation. That is, of course, the next part of the challenge. But having said that, all the pieces, right from ABDM, the Ayushman Bharat Digital Mission, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, all of this are part and parcel of that original policy, right? So when you look at that, how does one make a pluralistic healthcare system vision into reality, right? This is the question before us. And without further ado, because we have very little time, to very quickly introduce our panelists today, and before we go to each one of them, we are fortunate to have Padma Shri Vaidya Rajesh Kotecha, who is the Secretary for the Ministry of Ayush, practicing Ayurveda physician, Vice Chancellor, former Vice Chancellor of Gujarat Ayurveda University, which is an institute of national importance, himself a practicing doctor, author, but most importantly, he's been spearheading the vision of the government of India through the Ministry of Ayush for the growth of these systems of medicine, right? And in the last 5 years, we have seen dramatic transformation. He's been part of making that and continues to lead that process. Thank you for being here, Vaidya Kotecha. We also have with us Dr. Atul Kochar, who, as CEO of NABH, needs no introduction, but NABH stands for the quality movement in healthcare today in the country. So without spending more time, we'll look forward to your insights on some of the pertinent topics here. Next, I would like to welcome Pankaj Sahani, Chief Executive Officer of Medanta Group of Hospitals, which is known globally for its excellence. In fact, most of you might know it's been the only hospital in the top 200 hospitals in the world selected by leading international, very credible selection process. So he's been at the helm of administration and leading the growth there. So it is also important that the vision of integrative medicine, which Dr. Naresh Trehan, as Chairman and Managing Director of Medanta, and his leadership team envision for Medanta, right, in terms of what to do, we'll get to partake of that vision, right? Finally, I have great pleasure in welcoming Dr. Shankar Narang, who's the Chief Operating Officer of the Paras Group of Hospitals. And as a senior administrator cum physician, I think it'll be wonderful to hear his perspectives. With this, let me begin by asking Vaidya Kotecha, from primary health to the post-tertiary quaternary rehabilitation, what do you see as the role of Ayush in contributing as a supportive system, or what is the role in integrative medicine? If you can share your views, please.
Thank you, Rajiv ji. Actually, when we look at this integrative care, we should look at this in a very holistic manner. You just mentioned about primary, secondary, tertiary care possibilities. And I would like to mention that as long as more than 25,000 either PHCs or CSCs, there is a co-located facilities of Ayush. So Ayush doctors are posted under NHM and they are working in a cafeteria approach with this primary tertiary care. This is one thing. Second thing is that all these national programs, be it RSBK or NCPCDS or National TB Eradication Program, everywhere we are part of implementation of these programs of the Government of India. Also, in Ayushman Bharat Yojana, we have 150,000 health and wellness centers. So out of these 150,000 health and wellness centers, 125,000 are supposed to be established from sub-health centers. So out of these 10%, 12,500 is given to Ministry of Ayush. So we are establishing standalone Ayush facilities at PSC level, at the health and wellness center level. But in addition, all of these 150,000 and other than that, there is a component of integrative model of healthcare for promotion and preventive care. And the packages are being designed in a way that we have this knowledge is translated into the actual practice at the public health level. This is the primary, and at secondary care level, all as at least 3/4 of the district hospitals are having a Ayush wing as a secondary care is already there, and they are having a very good kind of setup and infrastructure and facility and services. At the tertiary care level, of course, there is a, whatever I am mentioning, there is a need of scaling up, so it needs to be scaled up, but there are good models at every place, in a private sector. You just mentioned about the example of Medanta, where there is a wonderful integrative care model since so many years. I am aware that earlier, there was Dr. Geeta Krishnan, who is now in WHO. He was managing that, and now you are managing that particular facility. But it's a wonderful model where patient care in a whole system approach, in a holistic manner is required. And so when a patient goes, they need to have some different level of care for immediate solution for some health issue, but it doesn't end there. Sometimes we need to add rehabilitation perspective, sometimes we need to add the perspective of patients, well-being or promotion of health or quality of life perspective, or there is a possibility of integration in a way that both all these systems contribute to some part of the care, like in the patients of stroke, for example, or Parkinson's, for example. So that type of model is available in private sector. There are, these are one of the premier model, but there are so many more. And in government sector, we have a lot of good models of integration. Such integration, one is like in NIMHANS. There is, in so many years, we have our collaboration with NIMHANS. And earlier there was a center of Central Council for Research in Ayurveda. Now NIMHANS itself has created Department of Integrative Medicine, and where they have this discussion about the patient care, where Ayurveda should be included, where yoga should be incorporated for a particular clinical condition, and it is very successful. There are a lot of good publications came out. The another example is the Olida Institute of Ayurveda or such premier institutes where integrative care is benchmark. So this benchmark model is already there. And now I am happy to mention that at the senior level, at the political level, for example, Honorable Health Minister, Honorable Ayush Minister, there is a mechanism of sitting together every month. And it was agreed recently that all new AIIMS will have not only Ayush services component, but a Department of Integrative Medicine. So that is a good outcome.
All AIIMS.
Yes, all new AIIMS will have this Department of Integrative Medicine. So this is kind of, a lot of such things are happening. Before I close, I want to mention one very interesting example, that we had a pilot in 6 districts with the help of DGHS. So the pilot was in these 6 districts was, having intervention of Ayurveda and yoga, or homeopathy and yoga, or Unani and yoga into that level of non-communicable disease of 3 clinical conditions, either hypertension or diabetes or dyslipidemia or combination. And there was a screening of more than 1 million people, having registration of more than 100,000 patients, and this pilot was conducted for 4 years, so it was a serious exercise. And what we found is that just adding a little, as an adjunct therapy of Ayurveda or yoga or Unani to conventional medicine, the quality of life is improved a lot. It is based on this large scale study. Or adding yoga actually help into the quality of life improvement. And in so many cases, the conventional doctors sitting at PSCs, they have decided to either reduce the doses of medicine or in some cases stopping the medicine because they did not require. So that type of collaborative work at a very large scale is required. So as a translation of this experience, what we did, that in National Ayush Mission, we are working with National Health Mission. So we have launched these initiatives into the new National Ayush Mission being implemented since 2022 April. So it is happening. Thank you.
Thank you very much, Vaidikutija. In fact, the point that all the AIIMS will have a department of integrative medicine is a very specific step being taken. I think it is appropriate at this time to just clarify that the subtle distinction between integrative and integrated medicine, because these words sound very similar. And integrated, from what I've read about it over the years, is where one person knows multiple things and he's able to practice everything together, right? That's where, unless one is extremely well qualified and trained in multiple systems, it is not appropriate that he would be able to do justice, because to learn one system itself takes a lifetime. So this is to go beyond and learn. Integrative, on the other hand, is specialists of different breed or type working together seamlessly in the best interest of the patient, depending on the stage of the disease and the health needs. This seamless working together is integrative medicine, which is really the future, which even abroad people are really looking at as the way to go. I would now like to ask Pankaj Sahni. Pankaj, keeping this vision in mind of integrative medicine, right? What do you see as a quaternary care hospital of excellence, the scope of integrative medicine in a private hospital like yours today, and where it can go, the scope? And number two, how is the market demand for such services that you see emerging in time to come? Thanks.
So I think
in terms of domestic and the international.
So if you look at the continuum of healthcare, I often say this, that big institutions, especially in the tertiary and quaternary care space, actually we provide very little healthcare. What we are exceptionally good at is providing very high quality acute disease intervention. So probably they should call us a disease management industry, not a healthcare industry. We actually offer very little health. So if you look at the continuum of a patient's life cycle from being healthy, or what we are now calling wellness, all the way till end of life care, there is a complete stage in that. And I think that one of the things that I think Ayurveda, traditional therapies, whether it is Ayurveda or any other form of traditional therapies, and there are others beyond even the Indian ones, like Tibetan medicine, Chinese medicine, many of these traditional therapies, they can be very well used across this entire spectrum. They can be used in health, they can be used in end-of-life care, they can be used in preventive medicine. So this is one area which I see is a huge need and missing in many ways. Geriatric care is another area where I think that this is a huge need. The second thing, and you mentioned it a little bit, Rajiv, is that what happens today is that we work a lot in silos, and what Dr. Tren used to also say is that, modern medicine, after centuries of development, actually knows only 3 things, and all these 3 things are harmful for you. So he used to say, we know how to cut, which is surgery, we know how to poison, which is medicine, and we know how to burn, which is radiation. And all modern medicine actually does these 3 things and only these 3 things. Whereas Ayurveda and other forms of medicine actually have an alternative approach. So this can be integrated in to produce a lower set of side effects. And again, I just want to specify, what I used to call complementary medicine is that you'll have a surgery and then as a post-operative rehab, you will say, okay, why don't you go for some Ayurvedic treatment? I think this is not the goal. The goal is, can you reduce the intervention of modern medicine because you are now doing integrative medicine with traditional therapies? So I think this is, a very important aspect. And let's not forget, these things are maybe 1/10 the cost of modern medicine. Modern medicine is very expensive. And so in a country like ours, we cannot afford this kind of medicine, so we have to, bring these kind of things in. And then lastly, I would say something which is becoming very popular in modern medicine, but if you actually see Ayurveda and some of the other traditional forms have been practicing for centuries, which is what is now becoming called very fancily precision medicine and personalized medicine. Actually, all Ayurveda is personalized medicine. There is nothing called non-personalized Ayurveda. So we talk about this now in modern medicine that we must get personalized, but Ayurveda has been doing this since day one. I think, however, there are some challenges, and I don't want to tell that everything is hunky-dory because it is not. And the biggest challenge is actually we are not talking to each other. It is hard enough to get a cardiologist and cardiac surgeon to talk to each other, forget about getting a modern medicine doctor to talk to a traditional medicine doctor. So this is one of the biggest challenges, and we need to try to overcome these challenges. And the second thing is that, there is always something thrown at the traditional medicine that, where is the science, where is the data, what clinical trial have you done, what kind of study have you done? And again, I think that this is something which, probably I would say we as a country have not done as good of a job as, say, Chinese medicine has been able to do in terms of codifying this to be able to prove to the rest of the world the, value in this system. So I think that this, if we can kind of, look at addressing some of these challenges, then there is absolutely kind of nothing stopping us. And Rajiv, you mentioned internationally, first of all, forget India. America cannot afford modern medicine, so India definitely cannot afford modern medicine. And it's not only India, there are about 2-3 billion people from Africa all the way to Japan who cannot afford the kind of care which is delivered in the West. So this has to be the way forward, otherwise, we are heading for a big disaster.
Thanks, Pankaj. I think all the points were absolutely, fair and, reasonable, and, really appreciate it. We'll come back to some of the points you alluded to. At this point, I would like to ask Dr. Atul Kochar, sitting at the helm of Quality Accreditation National Agency, for something as hybrid as an integrative care model, how do you see something, a standard for that coming up? And does NABH have some plans to really come out with the standard which will enable these type of unique hybrid care to be brought out at scale and for a global audience, as much as an Indian audience?
Thank you, Rajiv. I think this has been a good discussion, and please allow me to add a little bit to what Dr. Kotecha sir and what Mr. Sani just right now pointed out. I think we must take a pause and look back at what the pandemic has made us to introspect. It has shown us that there is no right or wrong. We are all living in a gray world, and not one shade or 50 shades of gray, but a million shades of gray. And these gray have taught us that the best of the best healthcare which we try to emulate or look up to in the Western world has failed in the face of the pandemic. So if we are to face future pandemics, if we have to, build at a core strength, we have to relook and redesign the entire spectrum. And the integrated or integrative medicine, as you rightly pointed out, is at the core of it. We must strengthen our immunity. We must go back to the wellness, which Dr. Kotecha very rightly pointed out. So those are the core components we can only address if we do not work in silos and agree to collaborate and agree to bring together everything. Take the best of everything and weave together some system which has answers for all. Having said that, to come back to your question of accreditation and quality and the hybrid mode, see, NABH and accreditation in India at least is still in its teenage. We are into 18th year of operations. We today touch about 15,000 hospitals, and we are also extremely proud of our Ayush standards, which the Ministry of Ayush is so graciously and very hands-on actively promotes and helps us draft and streamlines also. So there are currently 200 plus hospitals, and very proud of your partnership also. And Dr. Kotecha has agreed to bring semblance of rationality into the 12,500. We have signed a MOU with Ministry of Ayush to assess all these 12,500 wellness centers and bring them at par in terms of modern rationality. I mean, I'm improvising as I go, but as Mr. Sani very rightly pointed out, what does the tradition of 5,000 years of therapy lack? Where it lacks that, maybe you very rightly pointed out, sir, that we are not talking to each other, we are not talking to our global compatriots. So if we are to create a system where our traditional or complementary or integrative medicine is given its rightful due, I mean, then we have to bring in certain processes which shows that these are process specific, they are system driven, they cater to patient safety, they are concerned about the quality of care, and we bring the modern rationality into this traditional domain. And accreditation is one very small such tool which helps us create such a system. As we have seen through NABH, if I can very proudly kowtow the thing, over the past 15 years, we have developed a system which is totally Atmanirbhar, self-reliant, and these are homegrown standards. And starting from scratch, they have been developed by partners, as you are, which are very connected to the ground. And they have given us ideas about what constitutes and which are benchmarked by the best in the world. So these standards, when we take together, they drive us and motivate us to work towards a process-centric approach, which at its heart as its healthcare quality, patient safety, not only patient safety, it also has staff safety, facility safety, and which is recognized by the best in the world. So all these system accreditation tool, if we agree to that, can weave together and give us that model. So this is a very small submission that all of us must work together that. And as far as the hybrid nature of your question is concerned, I think there is an element of regulation also. So in India, we are not one country, we are 36 countries actually. We are a big world, we are a big diverse universe, bigger than the Marvel. And amongst that universe, there are various models, and unfortunately the past has been a very federated structure where the key components of healthcare have been divested to the state, and each state has had its own mind. But thankfully now our policymakers, our top leadership has taken note, and they have agreed that certain basic tenets of quality in healthcare have to be adhered to. And I'm extremely thankful to Ministry of Health, Ministry of Ayush, and all the top leadership who have now started to go by the vision of One Health, One Earth, and Heal in India, Heal by India, a very strong motivator for the drivers for this vision. So very soon, hopefully, we'll see this hybrid mechanism. We, at our part, are extremely keen to deliver such a model, and I'm sure the world is now looking up to us to give us that tradition encapsulated in the modern wisdom. Thank you.
I'll just do a quick follow-on question, Dr. Atul. If you go back to the first Ayurveda NABH standards, which dates back to 2009, December, 2010, January, I think it was released, and today over 200 hospitals are there. If you look at this particular, the fact that at that time when the first hospitals got accredited, people didn't believe. And why I bring this is because how does one take a modern age JCI accredited and NABH accredited healthcare facility collaborating with a Ayush or an Ayurveda institution was a moot point. But when the key thing which I just wanted to stress was in healthcare delivery or in healthcare, process-driven healthcare, it is system agnostic, apart from certain core parts of like when I do a surgery or if I do radiation, how quality comes. But otherwise the fact it's system agnostic. But it would still go back, if you look at the path that has been taken in NABH, supporting Ministry of Ayush in bringing out the standard, it brought in medical insurance approval, CGHS. All of this has happened because quality standards was brought in. So similarly I'll come back, maybe you can think it over. How do we ensure that some models of integrative medicine are also accredited or approved under a standard so that that also gets covered under payer mechanism? You would like to answer right away?
Yeah, so I think over the past 5-6 years, under the dynamic leadership of Dr. Kotecha, we have seen that Ayush knowledge, traditional knowledge, has already been integrated as far as certain elite components are concerned. You know, we have interest in our standards not only from Europe, not only from the best of countries, the France, Germany, where so much work has already been carried out. There are specialized departments, we connected with them, and now we realize that one standard does not fit all. And we had to draft the entry-level Ayush standards. So in the tier 2, tier 3, tier 4 cities, we already have many centers of excellence, right, in the top metros. But if we are to not be satisfied with these islands of excellence, and if we are to strengthen and work on this traditional knowledge, we have to disseminate it far and wide. And for that, we have now entry-level Ayush standards. Yeah, so these standards have the promise to go and take this wisdom and bring rationality. So the traditional knowledge has already been there. What these standardization does is that we work in a very, very systematic manner and bring together all the goodness, promote publications, promote research, and also at the same time weave together all the goodness of modern medicine into this traditional domain.
I just want to clarify that traditional medicine itself is a very heuristic, rational system.
Yes.
But it's about blending two systems together. I would now just go to Dr. Shankar Narang. See, coming from the vantage point that you do, seeing the consumers who are coming to Paras hospitals, can you comment on changing consumer preferences for systems, you know, both Ayurveda, yoga, and other systems, but also towards such interplay, you know, of appropriate interplay between systems? So your perspective from the consumer.
So before I get on to that, I would like to make a comment. If not India, who else should get into integrative care? The amount of rich history we have, right from the time of Ramayana when Hanumanji brought the whole mountain to get Sanjeevani Bhuti, to the time of our first surgeon Shushruta, to modern medicine. I think we have been excelling everywhere so far. So I think India is the right place, and it's the right opportunity to showcase the world how can we bring the integrative care and support the overall health journey of a patient from preventive to curative to rehabilitative, if I have to put it that way. And coming back to your question, so I think we are one group who are present in tier 3 towns, tier 4 towns, like I would specifically use Darbhanga, where we have patients coming in, and even if it's an acute myocardial infarction and you tell them intervention is required, there is always a question, will something else help? They have been traditionally not so much, I would say, aware or educated about the intervention. So the first question which comes is, are there any other options which we can explore, whether it is in allopathic or whether it is in any other alternative medicine? So yes, I believe that definitely there is a huge scope. Having said that, we will have to define processes or SOPs where we see how this integrative care can work out, can help in primary health, in secondary health, in tertiary health, whether it will be a co-medicine or whether it will be an alternative therapy or whether it will be a rehabilitative therapy, maybe post-acute intervention by allopathic medicines. So that is something which we need to work on. And having said to that, I think we have enough data. The only requirement is to have it at one place and maybe somebody works on it to find out what works for us, including both the medicines, allopathic and alternative medicine.
Thank you very much, Dr. Shankar. I think those are very valid points. We'll touch upon some of that. Vaidya Kutecha, the point that Pankaj Sani alluded to, that the Chinese started supporting TCM from 1947. In India, I think it's been a little bit more later waking up to the promise, and pushing it hard in the last 8 years or so. So, two parts. First part is from the Ministry of Ayush's angle in terms of mainstreaming with proper, credible scientific evidence. Could you share what has been happening in recent years and what's the vision in the next 2 years? If there is anything in integrative, are you collaborating with any of the modern medicine partners also from the government? Your vision, please.
Thank you, Rajivji. Actually, lot of things are happening. I would like to put some examples. For example, recently in April, our Honorable Prime Minister, along with the DG WHO and Prime Minister of Mauritius, they have, they went to Jamnagar and had this groundbreaking ceremony of WHO Global Center for Traditional Medicine. This is a big benchmark for the traditional medicine in any of the destinations of the world. This is important that is coming to India is that this is first UN outpost being established in any developing country. Until recently, there was no UN outpost in any developing country. It is all in developed countries. So this is one thing that is happening. The other thing is that, to mainstream, there are conscious efforts going on. I also want to cite these examples of, collaborations with WHO and ICD in terminologies, in benchmark documents, that has far-reaching impact. Before I explain this, I also want to cite this, how China did and then we left behind. But we are not just copying China, but we are doing something more than that. For example, one generic problem is that if our products are going abroad, then there is an issue of, that whatever we use is as a medicine. Lot of countries do not accept it as a medicine. They accept it as a supplement, either as a functional food or herbal supplement or some medicinal plant supplement, etc. So when they ask for the standards, what we have is pharmacopoeia standards. So our pharmacopoeia standards are up to the mark. But when we talk about pharmacopoeia standards, there is a prohibition comes in that they say if it is a pharmacopoeia standard, it is a medicine. So now we are working with BIS since last 3 years. In BIS, we have, requested them to create a vertical of Ayush that has been accepted. We sent some experts also on deputation to BIS, and they have started creating Indian standards of Ayush products and services. Already 24 products, they are working on 24 products. There are a couple of Indian standards also published. So we are working with them and then requested to put a request to ISO of having Ayush sectional committee, which is also pending for voting, and we are hoping that it will be accepted in the ISO. What is the route is that once this is ISO standards of these products and services are identified and standardized, there is a huge potential of commerce. And one example I want to cite is that there is a CII study of 2017, which is based on 2014 data sets about the size of the Ayurveda market, manufacturing market, and the size at that time was $3 billion, $3 billion. So Rajivji and we were working together, we were working with CII, and we have decided in one of the event conference that in next 5 years we'll reach to $10 billion. Let's make a strategy from 3 billion to 10 billion in 5 years by 2022. And in 21 we have initiated another study by RIS, and we found that the sector size actually based on 2020, it actually went to the $18 billion. So from 3 billion to 18 billion in 7 years, 6 times in 7 years is not a small thing, it's a very big thing. It also opens up the possibility of integrative healthcare in the terms of products and services. So this has happened. As a parallelly, what we did is in WHO, we have collaboration and project collaboration agreements of different things. Like ICD 11, we have started creating morbidity codes of Ayurveda, Unani, Siddha. That has a long impact because once if if morbidity codes comes into ICD-11, there is a talking platform between these professionals of, the conventional medicine and Ayush practitioners. And there is a possibility of science component adding into these practices. Third is possibility of commerce, insurance portability. There are a lot of possibilities. So it is happening. China had to take 10 years to get it done, and we are, in 2 years, we reached at alpha draft, and alpha draft is also approved. Recently I went to Malaysia and there was multi-country consultation by WHO. We are hoping that by next 1 year it will be ready and published. So this is one very important thing for, for the business and for the sector. Another thing is benchmark documents of training practices of Ayurveda, Panchakarma, Yoga, and Unani by WHO. So all these training documents, practice documents are published. It is on the WHO platform. So it is good for many member countries to understand and approve these sciences. So these are also happening. And what is the future? Like in next 2 years, what we want to accomplish is that I want to mention one specific scheme. Is championship services which is available. And I want to mention this here because there are a lot of entrepreneurs, industry is also here. That Government of India, Ministry of Ayush is having this as a part of larger, like creating ecosystem of best services in the world. Is championship service is a multi-sectoral scheme, primarily managed by Ministry of Commerce. Ministry of Ayush is part of it. So I would request that if anybody wants to create an ecosystem of hospital or wellness center or even yoga center, there is a component of supporting by Government of India. This is one thing. The another thing is that, that in next few years we are also part of Heal in India, and we are working with Ministry of Health and Ministry of Commerce and all these government departments, working with the entrepreneurs, and then trying to make sure that India becomes a specialized destination, because all these conventional healthcare services, a lot of countries are offering. So they are our competitors. But if we add something into it, we are the only providers. I want to have a couple of examples, Rajivji. One is that we had a study with Charité University, Germany. It was a very big study. And it was a study of adding simple intervention of Ayurveda in osteoarthritis management. And it was found that in over the 8 weeks of time, there is a lot of improvement by just having just Pindasveda and Ashwagandha orally, along with conventional management. And it is published in a very good journal. So that can be replicated, and we can claim that our country is not only a destination for knee transplant, our country is destination for the conservative care of osteoarthritis or back pain. We all know, and there are a lot of meta-analysis that surgical intervention in the issues of the lower back or back pain is having the same outcome of the conservative care of Ayurveda and Yoga over the period of time, 3 years of time. So there are so many such evidences that we can capitalize. And integrative care, like having conventional care, like Pankajji mentioned, that it's not just acute crisis, but it's a total health solution. So if we add such component of these Ayush sciences, we are the only specialist of the world. So we can immediately become a leader. So that is a thought process we are working on. Thank you.
Anything you'd like to mention on your ILB, a Center of Excellence scheme, and where you're collaborating with that?
Thank you so much for for reminding me. Actually, we also are visualizing that can we have mechanistic aspects, like these sciences are being practiced since few thousand years. So everybody knows, based on cause and effect principles, that yes, if we do this works. But how it works? So if we are able to look at these mechanistic aspects, studies and researches, then it adds science to it. Science is already there, but it adds understanding of the scientist to it, and then create a large number of publications, which is convincing. And for the rest of the world, it is for us, it is a kind of showcasing of the strength. So that type of activity is also going on. Like we are having this Center of Excellence with ILBS, Institute of Liver and Biliary Sciences. So what we are doing, we are looking at the mechanistic aspects of Panchakarma therapies, Basti Chikitsa, Virechan Chikitsa, and we are getting very good outcome. It is under, studies are going on.
Yes.
But for example, understanding of Virechan mechanistic is based on microbiome, and we are seeing that whole entire microbiome colonies are regenerated, and positive transformation is happening, and in all inflammatory markers are going down. There's also explanation of gut-brain axis, etc. Few years before, you know, if somebody tells that there is a gut-brain connection, we would laugh at it. But now everybody talks about the Parkinson's and other neurodegenerative disorders and its connection with the gut. So that type of mechanistic studies we are doing with them. We are having a center of excellence in ILBS instead of IGIB instead of genomics and integrative biology, where we are working on this personalized medicine through Prakriti principles of Ayurveda. We all know that we have Vata, Pitta, Kapha, Prakriti. So we are working with them, and there are a lot of good publications. There another example. One more example I want to cite is futuristic, that we are collaborating with our science ministries like DST, DBT, CSIR, and we have requested them that, you know, this mechanistic aspects is only done through basic sciences. Then the argument is that all health research most of the health research is not done by doctors, is done by the scientists, khas karke basic scientists, biologists, physicists or chemists, chemistry experts. So we have convinced them that Ayush research is also not the only domain of Ayush people. It should be done owned by all science. And it is, this argument is accepted. So now we have we are creating a large consortium. In this consortium, we will be working on developing new drugs, new therapeutics, and establishing these all available therapeutics and modalities for the mechanistic aspects. Thank you.
That was a fantastic overview and of what's happening. I just want to touch upon one point, because what it reminds us that most nations, how we build geopolitical strength is through the structural changes that are brought in. So what China has been able to do over decades is to impose its will in terms of the global healthcare framework and bring that. So not that we're competing with somebody else, but India, particularly with respect to some of these systems. So those structural changes that we're seeing happen now in the recent years, ICD you talked about, the something in artificial intelligence that's happening with ITU and this thing, right? So all these things are very much path-breaking. But the other part which I also want to bring is that the Global Center for Traditional Medicine coming to India is not for Ayurveda, Yoga, Ayush, etc. It is for all traditional systems of the world coming to India. It's a major coup that we've been able to bring this in. So any type of validation, research, development that has to happen, the center will be, or center of gravity will be India. So we are able to partake, partner, and so on. And also with this G20 thing on the anvil, that gives us a chance to further take the leadership forward. Now coming, I know, I'm not sure how many minutes we have, Akankshita, if you're here, from CII, but quickly to, how many more minutes? Okay, so I'll conclude quickly. Yeah, so Pankaj, you began by telling we need to talk to each other, right? That was the remedy which you said, right? So how do you make people talk to each other is my question. What would you do?
So I'm not sure I'm best positioned to answer this question. I think the biggest issue that I see with this communication is, first of all, I had an old boss in one of my last jobs, and he used to say, you have to create the clash. Okay, and he had renovated the office to make sure that the staircase was only on one side of the building. They said, at minimum, people have to go up and down the stairs, so at least they'll meet there. So the entire renovation was focused on what he said is that you have to create times for people to interact. So I think this is something that we actually have not necessarily done a good job of, because if I take even this room, we will all leave this room and we will all go about our daily work and we'll forget about what we discussed here. And some years ago at one of these CII conferences, I had said that we make a lot of big promises and people come on stage and we give a lot of good gyan and then nothing. And I had requested CII to make a scorecard that every time a speaker comes and says we will do something, they should, before the next conference, check whether they have done anything before inviting them back. I don't think this scorecard ever got made. But we need to force ourselves to create these conversations. So my first thing would be create the space for this clash to happen. The second very important thing, and you see it in every aspect, is we are all experts in viewing things from our point of view. And normally when we are talking, we are actually, or when we are having a conversation, most of the time you are actually having that conversation only because you want to think, what should I say as a counter to that person? You are not actually listening. And I think we need to now change this narrative to be able to say that what is it that we can hear from the other person's point of view. So if I'm a traditional medicine Ayush doctor, what is it that the modern medicine doctor is worried about? What do they care about? If I am a modern medicine doctor, what is it that the traditional medicine doctor cares about? So just after this session, you know, I was meeting some young entrepreneurs and they were talking about doing something in mental health. And the first question I asked is that, look, it's great, but if you're going to come to my hospital and ask me to offer this service to the patient, the first question is, who is paying for this? Is it me? Is it the patient? Is it the doctor? Is it you? So we must be very clear that what's the point of view. I can be very nice in a CII conference and tell you, oh, this is great, you should do. But finally, the question will come down to what is it that each person is looking for.
So let me quickly follow
that's
up
what
that
I
point.
would like
So
push on.
quickly to follow on. So do you see economic value in this type of model? It's a hard straight question.
There is absolutely no doubt that there is economic value in this model, and to be very frank, Rajiv, our partnership in Medanta has proven that it exists.
Yes.
Right? And the only thing that I would say is that, you know, you have to do it to believe it. You know, we built a hospital in Lucknow, it's a 1,000-bed hospital. Everybody tells you, people are mad. You know, Shankar has the same story. I'm sure when he started Darbhanga, people told, boss, tum pagal ho kya? Kahan ja rahe ho? It's working, no? So we have to show up.
That's right.
And I think if you show up, 50% of the battle is won.
Going by that count, I think we invite everybody to participate and take an Ayurveda, you know, consultation and therapy. खुद, you know, melody खाओ, खुद जान जाओ, उसी तरह से Ayurveda एक, you know, परख के देखो, then you will never forget it, you know, it's a lifetime experience. Dr. Shankar, having heard whatever you have heard, right, today, right, would you, when you look at your chain of hospitals, right, and what would you do differently starting tomorrow? I'm putting on the spot to promote this new perspective of catering to patients across the health spectrum in an appropriate manner.
So, to be very candid, whatever Katecha Saab just mentioned, I was not aware of almost 80 to 90% of it.
Yes.
So I think the first and foremost thing would be creating awareness. That is something of paramount, I would say, right now requirement if we want to take Ayush further ahead. Look at the amount of money being spent on allopathic medicine.
Yes.
Why can't same happen on this? So see, creating awareness by saying it won't happen. We will have to work towards it and we will have to spend towards it. So that is something we need to do. And personally asking me, when we were designing some of our new hospitals, we have decided to keep a department of alternative medicine in that.
Just call it Department of Ayurveda and Yoga or, you know, medicine. Huh?
Ayurveda,
let's not use the word
homeopathy,
alternate
Unani
medicine.
yeah.
Okay, thank you very much, Dr. Shankar. Finally, Dr. Atul, you know, from an NABH angle, I go back to the original point, you know, can we expect something new? Because there are standards internationally for transition care, rehabilitation, so specific specialized standards which will allow more integrative approaches which are approved by the payers, whether it is CGHS, because if you go to an Ayushman Bharat Pradhan Mantri Yojana for stroke rehabilitation, there will not be a proper care package within that. So you can't treat a stroke patient, rehabilitate such a patient only by giving medicines. You need a proper integrative care approach, physical and medical rehabilitation, PMR, combined with maybe Ayurveda, yoga at different stages. Do you see such standards emerging from NABH? Quickly.
No, definitely. So we are the face of the industry. I mean, whatever is the industry demand, we are willing to fulfill. We rely on technical experts. We stand tall on the shoulders of our SSS. So we can create that ecosystem very promptly and scale it up. But the demand has to come from the industry. And I think the climate is just right. We are speaking about it. The policy makers have taken note. And there's so much optimism in the air as far as integrative medicine, as you mentioned, is called. So I think personally extremely optimistic to look at it. Thank you.
So let me conclude, since we're running against time, that as I thank my esteemed panelists over here, I think I would also like to thank CII for creating that staircase, which Pankaj was alluding to, where all of us could meet and talk to common purpose. So I think today was an example of actually getting different stakeholders to come together and have this dialogue. And I think it's very important to have this. So I want to thank CII, of course, and our esteemed panelists. Let's take the dialogue forward. Thank you very much to everyone. Just one question maybe, and then, yeah. Yes, please.
This is for the organizers, CII. 5 A's you have written there: adaptation, affordability, accessibility, accountability, awareness. All of this comes through Ayurveda and Ayurveda yoga. So this session, which has been kept at the fag end of the day, it should be kept in the beginning. Second point, the definition for health, as Rajiv ji has mentioned, it was given 3,000 years ago, which WHO gave 300 years ago. That same definition was given 3,000 years ago by Ayurveda, our first surgeon or the first physician, Sushrutan Charagan, all those, the rich legacy which we have. So the biggest point which is lacking, I myself, allopathic practitioner, but I, being from University, I have a strong affinity for Ayurveda. What I have found in Ayurveda practitioners is lack of self-pride. This is our own medicine. This is something which we should have, that pride of attachment to it. So we have a whole lot of allopathic hospitals lined up. We should have on similar lines Ayurvedic hospitals also. CII is one of the partners in G20 also. In G20 also, integrative medicine. So integrative medicine, since we have the global center here also, we have secretaries are sitting here. Ayurveda and yoga should be synonymous with the integrative medicine. So to that level, we have to think forward. And the chambers of industry, CII as one of the leaders, they have a very important role to play into it. So I expect sessions on Ayurveda and yoga exclusively and explicitly in the pre-lunch sessions. Thank you.
Thank you very much. Really appreciate it. I think Vaidya Kotecha, one quick comment on what he just told.
No, actually, we all applaud, whatever you said, we all understood that you spoke from your heart. So thank you so much. That is what I wanted to convey.
So with this, we come to a conclusion of this session. Thank you once again, speakers.
Thank you. Thank you so much, Mr. Vasudevan. Thank you to our panelists. With this, we come to the end of the 19th Health Summit 2022. Thank you so much for being with us. I will request all of you to please join us for some snacks and tea. And we look forward to welcoming you next year with us.